This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome to Decoding Dentine Discussions, the podcast where we explore the latest advancements and best practices in the field of dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and today in episode 3, we will gain an insight about dentine hypersensitivity and other differential diagnoses. Today's episode is titled Spot the Difference, Dentine Hypersensitivity versus Other Conditions. So thus far, we've talked about the etiology, the science behind dentine hypersensitivity. We've talked about mastering dentine hypersensitivity diagnosis. Now what's important is to really understand how dentine hypersensitivity differs from other conditions so that there's not a problem in diagnosing and issues in treatment modalities. So today it gives me great pleasure. We have Professor Dr. Ali Cekici, a professor at Istanbul University, Turkey. He's a board member of the Scientific Affairs Committee of the European Federation of Periodontology and the president of the Turkish Society of Periodontology. As an expert in the field, he will be helping us break down the complexities of diagnosing dentine hypersensitivity and differentiating it from other conditions. Welcome, Professor Ali.
Hello.
Hi. So, Professor Ali, I'd like you to start off first of all. I've given a brief introduction about you. If you could just give us a little bit more information about you and your work that you do in Turkey.
Okay. First of all, thank you for inviting me to this wonderful podcast. I think people who will be listening to this podcast would benefit so much. I'm a professor of periodontology in Istanbul University, dentistry faculty, and I'm especially dealing with periodontitis cases and periimplantitis also. But for today's topic, periodontitis and periodontal treatment would become a topic. And as we know, dental hypersensitivity also be present in periodontitis cases due to gum recessions and exposure of the dentine on the root surfaces. So that's my one of my daily routines. So I hope all this recording would bring some insight.
I think we will be gaining a lot of insight from you and your experience and expertise. This episode is brought to you by Halion, the producer of Sensodyne. You can start recommending Sensodyne today to help you invest in a sensitivity-free future with continued use. So before I start asking you questions, I just want to give a bit of a preamble. In June 2024, Halion and CAP hosted an international advisory board focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we're exploring the key outcomes and clinical insights from that event, offering practical advice and evidence-based approaches to improve patient care. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. So we're going to dive into the topic. And one of my first questions is, how would you describe pain in dentine hypersensitivity? What is the clinical presentation of dentine hypersensitivity?
First of all, this is a condition that's a complaint coming from a person, from a patient. So a patient describes this as a short, sharp, and sudden pain. A discomfort occurs in response to specific stimuli, such as cold, hot, sweet, acidic foods, or sometimes with tactile contact like brushing. So this is usually how it is described.
And Do you see this often in your daily practice? I mean, how often do you see dentine hypersensitivity cases?
This is actually, it's very common.
Okay.
It's very common.
Mm-hmm.
Probably it's more common than we think, because
Mm-hmm.
sometimes people doesn't mention it until
Okay.
you ask them. So this is kind of a tricky situation. So it's not something usually a patient complains and refers to the dentist.
Okay.
It's usually something a dentist figures out during the examination.
Okay.
Usually, but it's very common.
Okay. What other conditions can dentine hypersensitivity be confused with?
There's a long list, because
Okay.
because sensitivity might come as like a pain, or discomfort, or sometimes unable to chew type of complaint. So one of the typical differential diagnosis would be a cracked tooth, maybe,
Okay.
which we see increased pain when functioning.
Mm-hmm.
Or dental caries is usually causes pain. Sometimes some tactile disturbance might occur, and also dental caries also presents itself with some pain or discomfort with temperature change, cold or hot. So that can be a confusing factor also. Another situation might be pulpitis. This is easier to tell, actually, to differentiate between dental hypersensitivity and pulpitis, because usually it is just in one tooth, sometimes maybe a couple more, but it's very, very easy to locate.
Okay.
And it's a sharper pain, of course.
Okay.
Other conditions might be occlusal trauma. Occlusal trauma is a very common issue, as we all know it. And sensitivity might occur following occlusal trauma for a certain time in people. This is maybe harder to tell in a single appointment, but a good follow-up would make the dentist differentiate between the cause of the dental hypersensitivity in this condition.
Okay.
There are others, actually.
Yeah, I'd love for you to mention them, please. It's nice to have that list to refer to, actually.
Yeah. I hope I won't miss anything behind, because any condition might present themselves as a sensitivity complaint. True. But let's say post-restorative sensitivity. If a tooth receives a type of restoration, and it's a deep restoration, then temporarily we might see some sensitivity in those tooth or teeth. That might also be complicating for a dentist to differentiate. But at least the history of the patient is known, then it's easier to tell it's a post-restorative sensitivity or it's a pure dentine hypersensitivity.
Okay.
One other issue, tooth whitening. Very common issue. And tooth whitening increases sensitivity in teeth, we know it. Following bleaching, sensitivity usually is expected, but it is temporary most of the times. So a good follow-up, and again, history of the patient is again crucial to have. Non-caries cervical lesions, like abrasion, atresion, erosion, these causes real dentin hypersensitivity. To monitor this type of defects and maybe do some flow tests, like airflow tests, or tactile tests, like touching with a probe to that lesion, we can know that there's hypersensitivity or not in dentine. And yes.
Sorry, I was just going to say, you've mentioned quite a nice, decent list here. So and then you've also mentioned, airflow tests. So this kind of brings me to my question. These other conditions that you've mentioned, how can we eliminate them from true dentine hypersensitivity? What would you recommend be a good protocol for a dentist to follow to make sure that they're going the right way to get the correct diagnosis?
This is always the most important thing for a dentist to know how to diagnose, because diagnosis is the key for every situation. Before we get a diagnosis, we don't know the proper way to deal with the situation or do the treatment, what type of treatment method or protocol we will follow. So yes, the proper diagnosis requires a thorough clinical examination for sure. Like we have to spend some time for a true good clinical examination. And also taking the medical and dental history of the patient, knowing the person. I would say not just asking questions, but try to get insight to that person's life is very important in not just in dentine hypersensitivity, but in every case. We need to know the person, what type of lifestyle that he or she is living, or what are the daily practices that he or she
does. It's interesting you say that getting to know the person is so important. It's just you've reminded me of a case where I was seeing a patient and was doing my medical and dental history. And whilst I was asking, going through my medical history, they said to me, what relevance is this to dentistry? What relevance is this to me coming to you? And to me, it highlighted, patients aren't aware how important it is for us to know everything, a lot about them, if not everything, about their individual lifestyles, habits, what they are ingesting, and so on.
Yes, drinking habits, or having any reflux, or maybe vomiting, or any other issues they might have, as well as medications. Oral hygiene habits is very important to know for a person. If they're complaining about hypersensitivity in dentine, because usually it's a very common scenario that we see over brushing or over cleaning of the mouth. Sometimes, of course, we see less cleaning than it should be, but sometimes we see some over brushing, which might cause some lesions and leads to dentine hypersensitivity. Also, nutritional factors might be important, because some people are digesting a lot of acidic food, drinks and food, and or they're eating just one type of food, or they're, let's say, having acidic foods in the very early hours of the day. This type of things might be dealt with the pH of the mouth and the buffering capacity of the saliva. So it is a very important situation to know, because during the treatment we might offer the person, for example, eating that type of food in another time in the day. That might save them from a lot of problems, and it's a very simple thing to do. But taking dentine hypersensitivity important, taking it seriously, I think would make a real difference as a dentist, because then we can really change the life quality of our patients.
For sure. I think what ends up happening is either it's not diagnosed, or patients don't think it's important enough for them to mention it. and it goes under the radar. And the only time
Yes.
it surfaces as a problem is when it's become a more severe problem with, more invasive treatments, which then means more money being spent on it. So, you're right in that if it's diagnosed early, if we can, enforce a prevention program, a screening and prevention program, it becomes simpler to deal, and also, I would say, economically better. Correct?
Totally correct. I think this should be taken seriously by governments also.
Yes. Agreed. So I wonder, do you know if there's any data about incorrect diagnosis incidence of dentine hypersensitivity?
Not that I know of. There are a good number of well done clinical research about dentine hypersensitivity. Not every corner is covered, but there are good ones. And also there are some systematic reviews which can be taken seriously.
Okay.
But none of them includes this type of incorrect diagnosis data.
Okay. And I mean, I think one thing that's important is clinical experience that comes with the time, right? The more cases you see, the more patients you see, the more you understand about dentine hypersensitivity. And one thing I wanted to highlight here, and this is going to be discussed in a future podcast, is the multidisciplinary or interdisciplinary approach. I think you're a specialist, I'm a GP practitioner. One thing I've realized over my years of working is that, I won't always have an answer to where that pain is coming from, why it's coming from. We, as general practitioners, need to understand that and not be scared to call our colleagues in to come in and help us. What do you think about this?
I think especially between the general practitioner and the dentist or a specialist, we need more conversation between all, because some of the information is hidden somewhere in another doctor or in the patient. So everyone has to share what they have in terms of dealing with a complex situation like pain, because dentine hypersensitivity might present itself when it's severe like a pain. And it's very confusing for a person to discriminate the source of the pain. So it is sometimes very complicated, because sometimes a treatment has been done very, very recently, like let's say endodontic treatment or a restorative treatment or a prosthetic treatment, whatever. But there is some pain somewhere, and you have to figure out where it's coming from. So every single point of treatment might be a cause for that pain. So we need good communication between all the people who are involved.
Of course, that's very, very important. So what I'd like to come on to is if we incorrectly make a diagnosis of something else other than dentine hypersensitivity, how can this become a problem? How is this a problem?
Well, there might be some speculations, of course, at this point. But usually, when we misdiagnose some kind of situation, then it means that pain would be continuing. So you will be leaving the person with pain for a longer time, or discomfort for a longer time, depending on the severity. The easiest thing can happen is this kind of situation would lead to poor oral hygiene, because if a person is having discomfort or pain when touching the tooth or a teeth, then they would be more likely to just pass that point when they're cleaning the mouth. So they won't be dealing with the oral hygiene at that part of the mouth. So which would lead us to a lower rate of plaque control, which we don't like to see.
Yeah.
So which might, again, at least lead to gingivitis, or in some cases, even worse, if the time goes for a longer time. And if the case is an occlusal trauma case, then a prolonged true diagnosis, then we might lead to temporomandibular joint disorders in some people. Yeah. If the occlusal trauma is at that state, and if the person is likely to have this type of disorders, it might get to that point. Not very common maybe, but it might. And if the case is a dental caries, then instead of having a simple restoration, the person might end up with endodontic treatment, let's say. So at the end of the day, if we misdiagnose a case, then the time passed during the true diagnosis happens would worsen the situation, what the real cause of the situation is.
True. Do you have any specific cases or scenarios that you might have come across that you can tell us about?
Like misdiagnosis?
Yeah, misdiagnosis or diagnosing. Any interesting cases you've come across?
Well, I wouldn't say interesting because at the end it gets to a very worse scenario that we don't want to see, because which means as a dentist, then you could not do your job at the time correctly or fully. Then your patient is having a severe situation or having a more invasive treatment. So at the end, it is something like this. It comes to that. Most likely, what would happen if we misdiagnose dental hypersensitivity, if the case, the true reason, let's say, caries, then it's very likely that that person would have an endodontic treatment at the end. This is the most likely scenario, I would think, that a dentist can have. And also, of course, the lack of oral hygiene because of discomfort in the mouth, it's a very common issue. It's like something every other day I can see a patient like that. And you want to motivate your patients for better oral hygiene, but the patient comes and then tells you that I cannot touch that part of my mouth easily. So there's something stopping you there. So right and true diagnosis is very important, and we should spend some time on that.
For sure. Agreed. So I think as clinicians, sometimes what we often experience is dentine hypersensitivity following non-surgical periodontal therapy. Is this a common issue? Is this something that other colleagues have mentioned to you or that you've come across?
Well, this was the topic I was saving for last. Yes.
Oh, perfect.
This is my daily life, as many other dentists and periodontists most probably would have the same scenario in their clinics. It's a very common issue, because especially in the more severe cases like stage 3 and 4 periodontitis, usually we see swelling of the gums before treatment. And we see bleeding, and the patient has discomfort, but because of other reasons. So after non-surgical periodontal therapy, we see the resolving of the inflammation. So the gums actually retracts and gum recession occurs in most of the cases, which means now we have the root surface exposed to the mouth. At this point, usually after treatment, let's say some of our cases, but I would say most of our cases, would feel some hypersensitivity issues. Maybe for a temporary time or a prolonged time. It depends. I think at this point, and this is a very, very common situation, for if you're dealing with periodontitis, then you would be ending up at the end of the treatment with gum recession and sensitive teeth usually. I find it very important that before the treatment begins, we should inform our patient in terms of this situation also, not just the resolving of the inflammation and the gum recession, but also the dentin hypersensitivity that we might see. Usually it's for a short amount of time, but in some patients it's taking more than we think. It's taking maybe months.
Do you have any? Do you have access to any data about percentage of patients that do experience this after non-surgical periodontal therapy?
There are some reports. There are newly published ones. That dental hypersensitivity was associated with gingival recession and erosive tooth, of course, and even when there's recession, the tooth wear, the erosive tooth wear, is more likely to happen because now if we are there with a patient after the periodontitis treatment, then we have exposed root surfaces, and as a dentist, we want our patient to do the oral hygiene at his or her best. With excessive tools like interdental brushes, sometimes automatic brushes, sometimes manual brushes, sometimes mouth rinses. A lot of things would be needed for taking good care of that kind of situation. So, which means we want our patient to brush or touch the exposed root surface more than a normal non-periodontitis person. So, which means we're in a state that we need gentle enough cleaning protocols, but very successful oral hygiene at the end. This is a dilemma maybe, but it is what we need.
Okay. I have a question for you. Not all patients will exhibit dentine hypersensitivity despite having recession or having had deep cleaning. Can you explain that, why that is?
Actually, that might be because some people still have the cementum layer attached on the root surface. Not the dentine is exposed totally. It might be because of that, or maybe dentine is exposed, but the tooth itself had a way of treating itself or blocking the dental tubules in time, maybe. So that would be two possible explanations if the person is not having any other type of desensitizing treatment. So this might be that.
Okay. So you said this is something that you see quite often, dentine hypersensitivity as a side effect to non-surgical periodontal treatment. So can you give us a protocol to follow, or what should we do to help deal with the dentine hypersensitivity after a cleaning?
Yes. In every periodontist patient during the non-surgical periodontal phase, we try to educate our patient in terms of oral hygiene, what's best for them. And personally, I mean, this is not a spread out message. This is something has to be done in terms of the needs of a person specifically. So a person might need a different type of brush, or another person would need a dental floss instead of interdental brush, let's say. So this has to be tailored in terms of the need of the mouth of the patient. And this is the job of the dentist to do. It's very important. Choosing a softer toothbrush is one of the safest ways actually to deal with dental hypersensitivity, as well as choosing the Toothpaste too. As
Okay.
dentists, I think in our education we learn about, of course, the chemical products in dentistry, but not every dentist like to propose a toothpaste to the patient, or maybe they don't think it's too important. I would say it's not too important, but in a case like dentine hypersensitivity, or in a case that might have dentine hypersensitivity, I think we should take this more seriously.
Yeah.
For example, Sensodyne has the calcium sodium phosphosilicate novel technology, which is very good. We always use it, and we can start using this type of advice with the patient in the beginning of the treatment, not wait for the dentine hypersensitivity to occur.
Okay.
So we can start from the beginning of the treatment. This is not tried and tested, but for clinical expertise, I think this might maybe give us some advantage. Choosing interdental brush correctly, the diameter of the brush is important because it might traumatize if it's too big. So it is also has to be correctly selected. Other than that, follow the patient, listen to the patient, listen what he or she says is crucial during the treatment also.
For sure. So one thing, you talked about the Novamin technology, and not everyone is aware about what's inside the toothpaste. So I'm just curious, for you, what are the important ingredients inside a toothpaste?
If a dentist would advise a patient a toothpaste, then the taste should be good.
Okay.
Because they should be receiving it in easier if the taste is good. Of course, the abrasiveness of the toothpaste is crucial in terms of dentine hypersensitivity. If the particles are bigger, then it's trickier. But having small size and rounded particles, they're I think helping for the less abrasiveness of the toothpaste, which I find really important.
Thank you. So I have another question for you. You were a part of the advisory board in June that was conducted by Halion and Kat. What were your sort of key take-home messages from there? Is there anything that has changed in how you practice or how you get colleagues to do things with regards to dentine hypersensitivity?
Yes, the basic message that I came from that meeting was, let's say, not start, maybe ask more questions about dentine hypersensitivity to your patients if they're experiencing it. So, because there are many hidden cases like this.
Yes.
This is I think the key point that we should get at this point, at least, about dentine hypersensitivity. Yeah.
Okay, perfect. Thank you very much for being a part of this today and for giving us your time. So I just was going to quickly summarize everything that we've discussed today. We focused on dentine hypersensitivity and it's the symptoms of it, signs and symptoms of it, the sharp stimulus triggered pain. It's overlap with other conditions like caries or pulpitis or cracked tooth. It's so important to have an accurate diagnosis so that the correct treatment modalities are offered to patients. Accurate diagnosis requires a thorough examination, patient history, and awareness of factors like diet and oral hygiene habits. As mentioned, the risks of misdiagnosis are, complications such as TMJ disorders arising or unnecessary treatments, or the patient being left in pain and a worse condition within the mouth. So incredibly important that we do this. And what was also really nice to talk about was, something we all experience when we've provided treatment of a non-surgical periodontal therapy to patients. They often complain of sensitivity afterwards. And what I think Professor Ali said that is quite important is the informed consent aspect. We need to inform patients what we're doing, what they might expect afterwards, and what they need to do to help mitigate these side effects afterwards. So Professor Ali, thank you very much for being a part of this. It's really lovely having you on air with us, and we look forward to seeing everyone again for the next episode. See you soon. Thank you. Bye.
Thank you very much.
This episode is brought to you by Halion, the producer of Sensodyne. You can start recommending Sensodyne today to help you invest in a sensitivity-free future with continued use. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.